Bismillah ar-Rahman ar-Rahim. This is Professor Abdussalam Yasin Taha from the College of Medicine, University of Sulaimani, giving a talk on vascular education and training, the Iraqi model. Vascular surgery is delicate, requiring the best type of training to achieve the necessary anatomical knowledge as well as skills to deal with healthy and diseased vessels throughout the body in both elective and emergency situations. Countries differ in their educational and training programs in vascular surgery. No single model can fit the needs of all nations. In many countries, UK for example, vascular surgery is practiced separately from general, thoracic, and cardiac surgery. In contrast, vascular surgery in other countries, including Iraq, is part of cardiac or thoracic surgery. Vascular surgery education and training in Iraq is dynamic and positively changed over the years. In this lecture, I will try to emphasize the significant features and changes from the early 1960s till now. Standing on the shoulders of the giants. Whatever we achieve in our career, we should feel humble and grateful to our teachers and remember the letters of Isaac Newton. If I have seen further, it is by standing on the shoulders of the giants. So it was the beginning. In 1963, 3 centers of thoracic and cardiovascular surgery were established in Baghdad, the capital of Iraq, by pioneer Iraqi surgeons, namely Professor Nazar Baqir al-Hassani, Professor Yusuf Dawood al-Nu'man, Professor Muayyid al-Umari, and Dr. Adnan Sarsam. We are grateful to those pioneers in vascular surgery who obtained their postgraduate training abroad, mainly from UK and USA, and returned to Iraq and then trained generations of competent vascular surgeons who served the community for decades and spread their knowledge to others. Pioneers in vascular surgery in Iraq included Dr. Muhammad al-Barbouti, Dr. Hussein al-Mashad, Dr. Siddiq al-Khashab, Dr. Muhammad Salih al-Ani, Dr. Faisal Haba, Dr. Mustafa al-Ward, Dr. Azhar Kamil Kassab, Professor Walid Mustafa Hussein, Professor Imad al-Mashad, Professor Nazar Baqir al-Hassani, Professor Hamid al-Ani, Professor Auf al-Samarai, Professor Abdul Khaliq Zaki Bnayan, Dr. Najih al-Asadi, Dr. Najm Hanna Hermes, Dr. Nazar Dawood Biteti, and Dr. Sami Wasfi. It is beyond the scope of this short speech to mention all the scientific achievements of those pioneers, but I remembered that the first carotid end arterectomy operation was published by Professor Yusuf al-Nu'man and co-authored by 2 of his colleagues as a case report titled Surgical Treatment of Arteriosclerotic Occlusion of Common Carotid Artery. This publication was published in the Journal of Neurosurgery at 1956. Professor Yusuf Dawood al-Nu'man, born at 1923 and died at 1986, received his training under the skill and guidance of the well-known vascular surgeon Mr. Michael DeBakey. In 1985, the College of Medicine, University of Baghdad, established a 2 year high diploma study in thoracic and cardiovascular surgery, from which 8 students have graduated, and then was stopped in 1988 with the beginning of the Iraqi board study. The Iraqi Board for Medical Specializations was established in 1988 and currently consists of 37 studies in different medical and surgical specialties. The Scientific Council of Thoracic and Cardiovascular Surgery is one of the studies under the umbrella of the Iraqi board. On completion of the study, the candidate gets the degree of fellowship of the Iraqi board, abbreviated as FIBMS, which is equivalent to PhD. The Iraqi Scientific Council of Cardiothoracic and Vascular Surgery was headed for the first time by Professor Nazar Baqir al-Hassani from 1988 to 2009, followed by Professor Imad al-Mashat from 2009 to 2014, followed by Professor Walid Mustafa Hussein from 2015 to 2020, and currently the acting head is Assistant Professor Dr. Abdul Amir Mustafa Hussein. Sorry, Dr. Abdul Amir Muhsin Hussein. The Iraqi board study consists of 5 years divided between general surgery 6 months, cardiac surgery 2 years, and thoracic and vascular surgery 2.5 years. The trainee rotates in 9 accredited training centers throughout the country and works as full-time resident under supervision of high-standard 13 trainers and 19 supervisors. The students are involved in the performance of a wide range of elective and emergency vascular surgical procedures. These procedures are documented in well-planned logbooks. So this is an example of a logbook designed to document the operations attended, observed, or performed by the student. And this is a form of logbook designed to document the other scientific activities such as the conferences, seminars, lectures, or journal clubs attended by the student. During the study period, the student attends weekly lectures, journal club, clinical meetings, mortality and morbidity meetings. Students who can afford studying abroad are allowed to have 1 year of their training done in a recognized international vascular center. Exams and thesis. The student must pass 3 major exams: primary, mid, and final. The student must do a thesis during the 4th year under supervision of 1 teacher. The student is not allowed to sit the final exam unless a thesis meeting the publication criteria is accepted by the examining committee. And this table shows the numbers of graduates of the Iraqi board for medical specializations in thoracic and cardiovascular surgery since the beginning at 1992 till the year 2021. As you can see, there are 226 graduates. Post-graduation. Graduates of the Iraqi board in thoracic and cardiovascular surgery are centrally distributed by the Iraqi Ministry of Health to all Iraqi governorates to work as thoracic and vascular surgeons. Some graduates join cardiac centers to be trained for 2 years to be a qualified cardiac surgeons thereafter. Some graduates have an interest to subspecialize in endovascular therapy, which was started in 2014 in Baghdad and other Iraqi cities such as Najaf in the mid of the country. So the endovascular therapy department in Baghdad was founded at 2014 by Dr. Abdul Amir Muhsin Hussein. A fellowship was started at 2017. 6 fellows have graduated so far, and another 6 students are enrolled in the study at the time being. The fellowship lasts for 2 years and accepts both graduates in thoracic and cardiovascular surgery. The students are trained on both open and endovascular procedures. I would like to thank my colleague Dr. Abdul Amir Muhsin Hussein for providing me with the data related to the endovascular therapeutic procedures performed in their department. So as you can see, there were 230 diagnostic angiographies, 1,402 PTAs, 407 stents, 16 EVARs, 4 TVARs, 68 arteriovenous malformation embolization, 45 pelvic congestion syndrome coiling, 9 false aneurysm coiling, 8 venous thrombectomies, 56 IVC filter placement, 32 renal artery balloon angioplasties, 11 angiomyolipoma embolizations, 24 uterine fibroid embolizations, 3 stent grafting of coarctation of the aorta, 78 central venous angioplasties, and 116 hybrid procedures. A Najaf Center for Cardiac Surgery and Transcatheter Therapy is another center for performance of endovascular therapies headed by Dr. Khalid Amber, who is an interventional cardiologist, and they have very good results in coronary and peripheral vessels, and currently they have a 1-year diploma study accepting postgraduate students from vascular surgery as well as cardiology. Postgraduate studies in the region of Kurdistan, Iraq, in vascular surgery. There was a high diploma 2-year study from the College of Medicine, University of Suleimani, started at 2013 and stopped at 2016 after graduation of 7 students. Then the Kurdish board, which is a 4 to 5 years study, was started at 2016, from which 26 graduates have graduated so far. Moreover, endovascular therapy is a practice in Suleimani Cardiac Hospital with good published results, but so far there is no regular formal study of endovascular therapy in Kurdistan at the time being. Vascular surgery and the war. We regret to say that Iraq was never in peace since 1980. Due to financial issues imposed by the war, training abroad dramatically decreased. Nevertheless, Iraqi doctors compensated by attending international scientific conferences whenever possible. Shortage in vascular grafts and other necessary vascular tools such as Fogarty catheters in the wartime was another challenge. Despite the ugly face of war, it has a great role in increasing the expertise of the vascular surgeons. The Iraqi model is a good example. The future. A proposal has been recently submitted to separate the study in the Iraqi Board of Thoracic and Cardiovascular Surgery into three distinct studies: cardiac, thoracic, and vascular, starting from the year 2023. We wish to have all our future vascular surgeons to be well trained in both open and endovascular surgical therapies. Take-home messages. Our giant pioneers provided a strong foundation for the Iraqi model in vascular education and training. Despite the war and financial constraints, the Iraqi vascular surgeons never stopped. Training in vascular surgery should not be limited to vascular surgeons, but general and orthopedic surgeons also need such training, as they may work in areas lacking the facility of vascular surgery. And with this nice photograph of Martyrs Monument in Baghdad, I wish to conclude my lecture. This is Professor Abdulsalam Yassin Taha signing off from the College of Medicine, University of Sulaimani. Thank you for watching and listening to my lecture.